Okay. Feel the ribs. So here's the lower 9 ribs, right in here. And then the transverse process of the cervical vertebrae. So here's the cervical vertebrae, and then there's transverse processes. I can roll my thumbs to make sure that I am on them. And then the mastoid process of the temporal bone. So again, I could ask her to look that way. And then back here, I could find that. So if you could just turn towards the camera, kind of. Now you're towards me. Right back here. And then, yeah, so the action of this is going to be to unilaterally, laterally flex the vertebral column to the same side and bilaterally extend the ventral column. And the nerve for this is going to be a spinal nerve. So the next muscle I'm going to show you guys is the multifidi, and this is going to originate at the sacrum and transverse process of lumbar through cervical vertebrae. So the sacrum, I'll come back here, find the posterior iliac crest, your PSIS, go to the sacrum. I can roll my fingers, make sure I'm on it, right here, and then transverse process, I'll use both fingers, so it's lumbar through cervical vertebrae, so it'll be all the way up to cervical, and then the insertion is going to be the spinous process of the lumbar vertebrae, through the second cervical vertebrae. So cervical vertebrae, C7, 6, 4, 3. Okay, so 2, C2. And then the action of this muscle is going to be unilaterally rotate the vertebral column to the opposite side, and it's going to bilaterally extend the vertebral column. And the nerve is spinal. So the next muscle is going to be the rotators, but the origin and insertion are exactly the same, except the only difference is they span 1 to 2 vertebrae instead of 2 to 4 vertebrae. And then the action is going to be it unilaterally rotates the vertebral column to the opposite side and bilaterally extends the vertebral column, and the nerve is again going to be spinal. Okay, so the next muscle is going to be the quadratus lumborum. The origin of this is going to be the posterior iliac crest. So I will palpate with both hands, find the posterior iliac crest. And then the insertion is going to be the last rib. So I'll use both hands, palpate, find the ribs, go down to the last one. And then the transverse process of L1 through L4. So use both hands. I know the last rib was here. Both hands to feel both sides. Okay. The nerve is going to be the lumbar plexus T12, L2, L1, 2, and 3. And then the action of this is going to be it unilaterally, laterally tilts and elevates the pelvis. It is going to laterally flex the vertebral column to the same side and bilaterally extend the vertebral, fix the last rib during forced inhalation and exhalation, and yeah, that's it. Okay, so the next muscle is going to be the rhomboids. The origin is the spinous process of T2 to T5. So spinous process, can you look down? Here would be C7, T1, T2, 3, 4, 5. That would be the origin. Then the insertion is going to be the spine of the scapula, medial border of the scapula between the inferior angle and spine of the scapula. And then the action is going to be to adduct the scapula, elevate, and downwardly rotate the scapula, and the nerve is going to be dorsal scapular, C4 and 5. So the last muscle is going to be the latissimus dorsi. The origin is going to be the inferior angle of the scapula. The spinous process of the last 6 thoracic vertebrae, so C7, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, so last 6 here, and then the posterior iliac crest as well. So I would come down here, same as I did earlier, find the posterior iliac crest. Okay, and then the insertion is going to be the intertrabecular groove of the humerus. So that's going to be around the front. And in order to find this, I could ask the patient to go like this. So move your arm. And then I could feel it moving underneath my hand. Can you move it again? Right here. So there, and then that makes sense because the action of this is going to be extend the shoulder at the glenohumeral joint, adduct the shoulder, and medially rotate the shoulder. And the nerve is going to be the thoracodorsal, C6, 7, and 8.